Hello guys, and welcome to this video to talk about one of the most common questions from you guys, which is how to differentiate caries from the remaining dentin, okay? And you guys keep sending us this question, especially to the tutors of restorative dentistry participating in this channel. And we have selected now 3 main key points to help you guys answering this question, okay? But before seeing those key points, let's take a look at this case that I have selected for you guys, because it's one of the first cases of my career, and there's actually a reason why I selected this case for you guys, okay? So on the left side of your screen, you guys are seeing caries, of course, so you might notice that, we have caries. And then on the right side of the screen, the caries were completely cleaned, and now you guys are seeing the dentin all over the place, okay? So both pictures were taken without the rubber dam because it was actually before I applied the rubber dam. So of course I used the rubber dam to treat the endo, but then to take those pictures, for example, the picture on the right side of the screen, first I removed the temporary restoration, and before doing the final restoration, which is the one that you guys are seeing on the right side of the screen, it's the restoration that I could do at that time, I decided to take this picture before applying the rubber dam. But there is actually a mistake here which allows me to see the different shades of dentin, and the mistake is basically that to treat this root canal I failed to expose the entire pulpal floor, okay, so the floor of the pulpal chamber, right? So if I did expose, then you guys would be able to see a dark line connecting the 3 root canals, okay, so more or less in this area, so we would have a darker line of dentin here, because this would be the pulpal floor, okay. However, I failed to do that and then just exposed the pulpal floor very close to the root canals. I still was able to perform this root canal treatment, and the restoration is still there on the mouth, but at least I can show you guys the different shades of dentin, right? So the color of dentin, the normal color would be pale yellow, but then you guys are seeing that in areas like this one, for example, the dentin is darker, and the closer that we are to the pulpal chamber, then chances are that we are going to find tertiary dentin, and then the color would be a little bit darker, okay? But it's also normal to find different colors, and we are going to talk about the aspects of a healthy dentin soon in this video, all right? But before that, let's talk about the first key point of this video, which is that we should detect infected and affected dentin areas, right? So infected dentin would be the dentin contaminated by bacteria, right? So the bacteria is contaminating and is causing the collagen to be denatured, okay? So now the collagen is denatured and this process is no longer reversible. However, for the affected dentin is not so soft, is a little bit firmer, okay? Not so hard as the healthy dentin, but it's a little bit firmer. And then we have the denatured collagen in a reversible state, okay? So this is very important for us to differentiate. It's considered that the affected dentin can stay while the infected dentin should be removed usually. Although there are recent articles considering that infected dentin, depending on the case and depending on the clinical situation, could also be left on the cavity, right? But it depends on the case, it's not so simple, and that's why I'm even recommending a reference here for you guys, because as you guys know, we should be always based on scientific evidences to take those decisions, right? But it's still important to follow this first key point, because the infected dentin will usually come out using the curate, okay, and the affected dentin would come out with a little bit more pressure, but usually you don't need to remove everything. And the healthy dentin, of course, is not removable with curate. Usually you would need a burr to remove the healthy dentin. So this is also a very important difference that we should take into consideration, right? Well, so let's see the other key points now. The second key point is also very important. Assess the normal clinical and radiographic aspects of healthy dentin, right? So let's analyze this radiograph now. So in the third molar of this radiograph, we are seeing that the dentin is homogeneous, okay? So the radial opacity of the dentin is homogeneous all over the place, and that's why, you know, this is actually no problem for this tooth, okay? We have the pulp chamber there and everything. For the second molar, we can see a slight difference here, so some areas of dentin are slightly more radiolucent than others, but okay, you know, we should still correlate with the clinical situation of this tooth. The pulp chamber doesn't look, you know, too much atrophic either, so yeah, everything is still, you know, we should correlate with the clinical situation to give a proper diagnosis here. However, for the first molar, then we have a different situation, right? The pulp chamber is now atrophic because of the presence of tertiary dentin, which is the dentin that comes as a reaction to irritation or damage, right? And you can see that even if we compare the dentin area, we have radiolucent area here, okay? This area is more radiolucent than the rest of the dentin. And then, of course, you are still going to correlate with the clinical situation. We also need to take into consideration that this tooth has periodontal ligament space widening, okay, as we can see here, depending on the root, but we can see that this is actually happening here. But okay, so we need to consider the different situations of the radiographic aspects of the dentin. And this, you are going to correlate with the clinical situation of the patient, right? So if you consider now the situation of the dentin, take a look at this. We have the normal dentin here, right? So what are the characteristics of the normal dentin? The characteristics are dry looking, hard, darkly discolored, and plaque-free. Okay, so those are the most important characteristics of a healthy dentin. However, in this case, I'm already showing to you guys arrested caries areas, and there is even a node restoration, you know, and I actually had to cure it and to remove these caries, even though the root canal was already treated, before doing the restoration that you guys are seeing on the picture below that, right? So that's the second key point, and then the third key point that I would like to talk to you guys about is to identify the different types of dentin and, of course, the proximity to the pulp chamber, okay? Take a look. As I said when I was talking about the first case, you guys are seeing that on the picture on the left side, close to the center of the screen, you guys are seeing that the roof of the pulp chamber is still there, right? While only on the picture on the right side of the screen, the roof was completely removed, and now you guys are able to see the floor of the pulp chamber, right? Which we should expose nicely when we are doing our root canal treatments, but that's topic for another video, okay? So the types of dentin that we need to recognize, of course, you guys should know. Let's consider that we have the limits of the pulp chamber here, okay? So here is inside the pulp chamber, and this is the area of the tooth, okay, or the area of the dentin and enamel. And you guys should have the primary dentin, which is composed by the tubules, right? So the odontoblasts are here, the long cells, okay? And this is the type of dentin being built during the tooth formation, okay? However, at the limits of the pulp chamber, then you guys would find dentin with a different orientation of the cells of the tubules, okay? And then this would be the secondary dentin, right? So the secondary dentin is the dentin produced after the tooth formation, after the tooth is formed, right? And then you could have the tertiary dentin, which is the dentin being produced as a reaction to damage, right? So this is a dentin being produced inwards in relation to the limits of the pulp chamber, okay? And that's why this is the dentin causing atrophy of the pulp chamber, okay? So this would be the tertiary dentin, while this would be the secondary dentin, and this would be the primary dentin, okay? And of course, the color of those change a little bit, and you guys would be able to analyze during your clinical assessments to see if we have healthy dentin or not, okay? So those were the main key points of how to differentiate caries and Dentin. And I hope you guys enjoyed. If you guys enjoyed, please click the like button, subscribe to our channel because we have every week videos and even some extra videos. And see you guys on the next videos.